Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Hello and welcome to It's a Code U. This week, we are going to be talking about being a long distance caregiver for an older loved one and things that you can do to make things easier to manage. Previously, I worked providing caregiver support and helping with long term care planning. So, this is a topic that is important to me because I know how difficult and isolating it can be. And as a twist, we are going to do this as an interview where Jennifer will be conducting the interview of me. So we'll cover just basic information about caregivers, things you can do to manage and navigate things easier, legal things you should be looking at, assessing needs, planning for increased needs, taking care of yourself, and we'll have some resources that we'll talk about, and those will be in the show notes.
All right. So, first off, I'm so glad that we are doing this topic, Adina. And I'm really looking forward to hearing your experience and expertise in this area because I think a lot of our listeners are really going to identify with either being caregivers in general or being long distance caregivers, or definitely knowing someone who is a long distance caregiver. I think we're seeing older generations continuing to get into that caregiving sort of state. So, Athena, how many people are caregivers in the United States right now?
So you bring up a good point and I'm reading a lot about that in the news, that the population of older adults who need caregivers is increasing drastically. And the number of caregivers has increased from 43.5 million in 2015 to about 53 million in 2020. So that's about more than 1 in 5 Americans. And by 2030, an estimated 73 million people in the United States will be 65 years or older. And that's according to the CDC, which is the Center for Disease Control. According to the National Alliance for Caregiving, about 15% of family caregivers live more than an hour away of the older adult they are caring for. And so a lot of what we're going to talk about is meant to assist long distance caregivers, but really the information is useful for anyone caring for an older adult. And I will say that when I use the term caregiver, sometimes people think that means like I'm showering this person or I'm being very hands-on, and that's not necessarily the case. The same way that there's a lot of mental work that goes into parenting and running a household, sometimes there's a lot of mental work that goes into caregiving, even if the person is still very independent and does a lot of things on their own. So just want to mention that for people to keep in mind.
So, when you're thinking about just basic things you can do to make the job of long distance caregiving easier, what comes to mind for you?
Well, in addition to providing caregiver support, I've also worked in inpatient hospitals providing discharge planning. So the first tip that I have comes from my experience in both of those roles, and that would be to create a care planner. It does just make things so much easier to have all the information in one place. You could think of making a binder, but you could also create a digital copy of this as well, especially since more and more places are accepting emails from patients instead of needing hard copies or faxes or things like that. But I would create a care planner, and in that, I would put anything and everything that would help someone take care of my loved one. So, health insurance information, information about medical diagnoses, lists of medications, assistive devices they may use, information about all their medical providers, any allergy information, and all of that will be very helpful. And if you have a digital copy, let's say your loved one ends up in the hospital and you are not there, you may be able to contact the social worker on the floor or the floor nurse and email a copy of this information to be put in the chart. Or they might be able to direct you of someone that you could email so that that could be included in the chart. But The second thing that I would suggest is to look for local help. So when you are able to visit, really try to connect with those people who are in your loved one's life. Get to know their neighbors. If they go to church or any community groups, join them, go with them to those places and meet other churchgoers or the other people in the group and exchange information with these people. So if they were to notice something's off or they have a concern, they will have a way to contact you. And you could also ask neighbors, for example, if they would mind stopping by occasionally to say hello. If you're not close by, you only know what's being reported to you. And sometimes as people age, they minimize issues for a bunch of different reasons. Maybe they're embarrassed, or maybe they're fearful of losing their independence, or maybe they're just in denial that they're struggling with something. There's lots of reasons why people minimize what's actually going on. But if you aren't there to notice that things are changing or that there might be a concern, making those connections with people who are there, give you some boots on the ground, will be very helpful and probably very reassuring as well. And the last thing I'll say is a costly thing to do, but if you have the resources, you could also look into hiring a geriatric case manager. This person can act as your surrogate. They can go to doctor's visits, they can advocate for your loved one, and then also keep you apprised of what's going on. They aren't the same as someone who provides in-home care with dressing and feeding and housework and things like that. These are usually social workers who have extensive experience in case management and geriatric issues. Usually they are on call, so if something happens in the middle of the night, they would be the one that would respond. And you'd want to check with anyone you reach out to about their policies, but I know some do offer on call as part of their service. I will tell you that they are very expensive. I have helped people get them in different states. And I think that one person for their assessment was $300 or $400, and then it was probably about 150 an hour. And that's going to be probably the same thing as like lawyers charge, where anything they do, if they're making phone calls on your behalf, if they're arranging something, that's going into an hourly charge. But it is a very nice thing to have if you have the financial ability to have something like that.
These are all excellent tips, Adina. And I also think that it's really helpful to acknowledge the expense that comes with sometimes what could be the best or most helpful resource in these situations, like having a full on geriatric case manager. But that is so incredibly out of reach for a lot of folks, even though it is such an incredibly huge, helpful resource. And it makes me think about health equity when it comes to aging and how access really is such a huge issue. It still is true that a person's zip code is one of the single biggest determinants of their access when it comes to healthcare. And I think for a lot of folks in the aging population, that is only more greatly exacerbated because they're facing sometimes greater health issues. But I also am thinking about the legal aspect of this too, right? Because as we age, there are certainly more legal considerations to be made, especially in terms of our healthcare. And if you are a caregiver for someone, right, oftentimes it's taken for granted that certain populations are literate to understanding medical documentation or care plans and things of that nature. And sometimes I think it's also helpful to have an advocate for someone who might not have the capacity or be able to give full consent to certain forms of treatment. And of course, there's also a lot of scams that target the aging population too. So I'm just curious, what sorts of things might a caregiver consider legally for their loved one?
So I'm actually going to address one of the other things you said first because I hadn't planned to talk about this, but it got my brain going and now I have to say it. So it's interesting. It's interesting that you brought up the different zip codes and access to healthcare. So, especially if you're a caregiver who is helping make the decisions between like traditional Medicare and Medicare Advantage plan and those types of things, or even a supplemental plan, one thing to understand is that not all plans are created equal and not all plans are available to everyone. Let's say you're taking care of your mom. Your mom's friend may say, "Hey, I got this really cool Medicare Advantage plan, and it includes, I don't know, all these extra things that are super wonderful, and you should get this plan," but they live in the next county over. Your mom may not be able to get that plan because it's the insurance companies contract this based on certain areas and all these things. Actually, there's a very good resource that I used a lot, and it is a free
Mhm.
service, and their agents are licensed everywhere. They don't sell you anything. They really walk you through the Medicare process and all of that. They're really, really great. I was also a Medicare kind of educator for a while. That's a certification I went through because of working in healthcare. I really wanted to understand all the ins and outs. But there's so many. I could do an entire podcast on Medicare and sign up periods and all of these kinds of different nuances of it. But I'll put the name of that in the show notes so that if anyone wants to go, I've actually given it to a client before who was facing retirement. And that's why she came to therapy and she wasn't sure what to do about Medicare because she was going to work for a little bit past the age and all these kinds of things. But it is just something to think about. Depending on where you live, you may have different options. But in terms of the legal things you can consider, if your loved one still has capacity, consider getting a power of attorney for medical decisions. I would also say possibly financial because I have seen a lot of cases where something happens, all of a sudden there's a huge cognitive decline and there was no one else on bank accounts. And now all of these bills have to be paid, but no one can access the money to pay them. That's just something to think about. It could even be just having your name added to their bank account so you can access it should you need to cover their bills for them or
Mhm.
whatever. But having the legal right to access their accounts, it's very important in case of emergency. But you can also have them do a living will, and that is where they can really spell out their specific wishes in different medical circumstances. They can also name who they want to make their medical decisions if they're incapable of doing so. And I've even seen ones as detailed where they spell out what they want to happen after they pass, like cremation or this is what I want done at my funeral. They can be very specific if that's what someone wants. But if you do either of those, I would get several copies notarized, keep one on hand, put one in that care planner I was talking about, and then make sure all medical providers have a copy on file and that they're scanned into the chart.
Yeah, that's excellent. All excellent information. I think too, if we're talking about things like advanced directives, whether that's healthcare power of attorneys or living wills, I think it's also important to remind folks that those are very state specific documents. And sometimes if you present
That's true.
an out of state document, if they happen to be in a hospital, it can sometimes take weeks for those things to get processed and verified. So, just important for folks to be aware of the different laws and ins and outs of that for your state specifically and how those might alter if you happen to go to a hospital right down the road that actually might be in a different state. I know that's with the New England area. There's a lot of those crossovers taking place between where we live versus where we go get our healthcare. So something to keep in mind for sure. Now, Adina, oh, go ahead.
That's a good point. Oh, I was just going to say that a lot of times you can look up, I know some states, I think Tennessee was one of them where the state website actually has a section where you can print off a form there. So I would just say, just Google it. But
Mhm.
a lot of states may have their own kind of living will or POA form. And for the living wills, some states don't even require them to be notarized. They just require two witnesses. I always don't like that. I'd prefer it to be verified.
So now, how might somebody go about really getting a good understanding of what their loved one needs? Because sometimes these conversations can be really sensitive, right? Folks can even feel like they're put on the defense if you open up talking about aging and planning for the future. So, how might someone know exactly what their loved one needs?
So I always tell people when you do go to visit, pay close attention to how they're able to get around the home. Are they struggling to get around? Do they stumble, or especially in certain areas of the home? Are they able to fully dress on their own? Do they seem like they're bathing regularly? That's something can sometimes can be a big indicator that it doesn't seem like they're bathing as much. And it could be because they're not able to versus they're just don't care if they bathe anymore. It could be a physical inability to do so. And you may want to pay attention to how they're driving, if they are still driving. When they cook, are they having good judgment about things? Do they take their medications as prescribed? Are they able to manage? Some people are on a lot of medications. Are they able to manage making sure they take all of those and at whatever time they're supposed to? There's some medications, morning, evening, whatever. And that can be very confusing, especially if you're on a lot. So, are they able to manage all of that on their own? And are they filling their medications on time? Are they getting their refills when they're supposed to? Or is that something? And some of these things are easy fixes. You can put them on home delivery where they're automatically sent if they can't get to the pharmacy. But these are all things that you can't really fix or address unless you know about them. So you really want to get a baseline for what their needs are, because then that's going to tell you if there's a decline that you should be concerned about, or if there's something new or different that may mean they need additional help, or it might mean they need a medical evaluation. Something could have changed. Maybe they have a UTI, maybe there's something cognitive going on or something else. Knowing what the baseline is for everything will help you
Mhm.
figure out if there's changes. Okay, something's going on. You may also want to consider making changes to their home, like moving rugs out of the way or installing grab bars or having a safety evaluation done for fall prevention. Alternatively, if mobility is an issue, there are certain things that you can put in place to alert you if they have a fall. For instance, Apple Watches have fall detection, and if it detects a hard fall, I read after you've been immobile for 1 minute, it will tap your wrist, sound an alarm, and then it calls emergency services or it attempts to call emergency services. So it's a little less embarrassing than, and I'm dating myself by referencing this commercial, but the I've fallen and can't get up lanyard type devices. But there are other ones on the market that are like bracelets and watches and are less obvious that this is a fall detection kind of thing. And then in terms of knowing what they need, I feel like it's also very helpful to have conversations early
Mhm.
about what the plans are going to be if there's a decline in the ability to care for themselves. So, if you can ask what their wishes are, then you can evaluate what's even possible. And if not, then come up with alternatives before it's necessary
Mhm.
so that there's less frustration and everybody's on the same page. So one of the things is, do they prefer to age at home, or if they get to the point where they need a lot of assistance, would they prefer a facility?
Mhm.
And if is there a long-term care policy that would pay for a facility or for in-home caregivers? Is the older adult a veteran or the spouse of a veteran, even if they've passed away, that may qualify for something like aid and attendance? And if they wish to live with a family member when they can no longer live alone, can they come live with you? Is that something that is within your ability or your living situation? Or is there another family member that's better suited, either due to living conditions or capacity to take on that responsibility? So these are all things to think about. You may also want to check with the Medicaid waivers in their state to see if they will qualify for one that might provide in home care or other assistance. So there's a website that I really love. I've used it a lot, and I'll put the link in the description, but it's medicaidplanningassistance.org, and it they update it very regularly. It's updated for every year, and you can look at the Medicaid waivers in each state for the elderly and disabled. You can see what the requirements are, both in physical and cognitive need and also income to qualify for it. There's usually a link that will bring you to the specific state website to apply for it. And this is another one of those things where you live matters. I have seen some states where you can have a whole bunch of money coming in and you could still qualify if you meet these things. And then I've seen other ones where I don't know how people live on that amount of money, and that's the max. So it's very state specific, because while Medicaid as a program does get some federal money, these are Medicaid is state run. So it's very
Yeah.
specific
Mhm.
per state. And but if someone qualifies, they do have a lot of benefits. You usually get a case manager assigned and you can get
Mhm.
assistive devices and there's all kinds of things. So it's definitely worth looking into, especially if you're dealing with someone who's not like super wealthy and they have some needs.
Well, that is all such excellent and helpful information. That you bring up the Apple Watch, right? And other more recent devices that can assist aging populations with their own personal safety or alerting their loved ones or medical professionals if there's a problem. I think that is such a wonderful use of technology because I too remember the oops, I've fallen and I can't get up commercial. And it brings to mind a Thanksgiving when I was a small child and the family was gathered around, full house, and I found a remote control that just had one big button on it, and it was on a lanyard. And being the kid I was, curious, I just pressed the button to see what would happen. And there were many very loud alarms going on. Suddenly, there was a speaker box, like in the dining room in the kitchen, with someone saying it was emergency services, and they were saying, Mrs. the name of my grandmother, are you okay? Respond, are you okay? And it's funny now, but at the time it was really embarrassing for her because not even the whole family had known that she was at that stage of needing something like that. And so it just to highlight how these advances in technology can also go to promoting human dignity, right, of our aging population, which sometimes goes to the wayside and taken for granted, right?
No, I agree. I have a story about my own grandfather, but my grandfather had had some cognitive issues and he got up in the middle of the night and he had put towels under the door, like stuffed them under the door so that ghosts could not come into his room at night. Got up to go to the bathroom and got tangled up in the towels that he had put on the floor to keep the ghosts out. And he fell and then he just laid there for I don't know how long because my grandparents were sleeping in they had different rooms. And so he laid there for a long time before he could yell loud enough for her to realize he was on the floor. And of course, she couldn't pick him up
Mm,
because she was tiny and he was very tall. So that was the whole thing. But I think about how many times I've had people come into the hospital
mhm.
where they have fallen and they have laid there for 8,
Oh,
10, 2 hours, 2 days. And it's just,
mm,
it's unnecessary. And it's also very scary because a lot of
mm.
things can change in that time, depending on especially what your injury is. What if they hit their head falling? So I think that what you were talking about with being able to age with dignity is a good thing about these kind of devices, but also just the safety. Like nobody deserves to lay somewhere for hours and hours with no intervention.
Yeah, yeah. That is so true. That is so true. So, being a caregiver, it seems like it comes with a lot of stress. I can see that probably physically, right? But emotional too. Maybe even feelings of guilt, right? So, what's what sorts of recommendations do you have for caregivers to make sure they're taking care of themselves?
I would say definitely set boundaries with what you can and cannot do, especially if you have siblings. One thing I saw a lot was that we all have family roles before when we're children, and likely those don't change that much as we get older. So maybe mom always thinks that
Mm,
her son Jimmy is the one who he does this and that. And then Susie Q is she's a girl, so
mm-hmm.
she needs to do this
Yeah.
because some of them can be very gender specific. And maybe as they get older, they just turn to Susie Q because she needs to do everything, or vice versa, because that's how
Yeah.
they view them. But she may not have the capacity to do that, or she may have her
Hmm.
own things going on and she literally can't take it on. So I would say set boundaries of what you can and cannot do, and then talk to other family members and be very clear about it. Hey, I'm happy to and this would be if you're living close, but I'm happy to
Mhm.
take mom to all her doctor's appointments, but I need you to get her groceries and
Mhm.
get her medication organized every week. That's
Yeah.
just a very specific example that came to mind. But things like that, like really enlist other family members if you have them. I do acknowledge that not everybody has
Mhm.
other family members they can rely on, but as much as you can, try not to take
Mhm.
everything on, set
Mm.
boundaries, get help. And then also make sure you're doing activities
Mhm.
that make you feel relaxed and grounded. I would say consider joining a caregiver
Mm.
support group. There's something very healing about knowing that you're not alone. And you can also maybe learn something from someone who's already been there. Maybe this is a new phase for you and you're not sure what to do, but someone else in the group has long been past that phase and already struggled through it. And they have a lot of tips and tricks that could be very helpful. There's a couple of resources, which are caregiving.org, caregiver.org, and the Alzheimer's Association,
Mhm.
which is alz.org. And I'll put all those in the show notes as well. But I would say the same thing as anything else. You can't pour from an empty cup. So anything that you can do to prevent burnout, take care of yourself, not take on too much, and communicate very clearly about that, I think are all good things that you could do.
Excellent. Excellent advice, excellent information. I really think folks listening are going to gain a lot of insight from everything you've shared today. Very needed. So thank you.
Well, I hope so. I really enjoyed doing the caregiver support, and I feel like there's to so many other topics related to this that I could do that people struggle with, and there's a lot of guilt surrounding having any
Mm.
negative feelings about being a caregiver, which is unfortunate because it is very stressful and not all relationships are healthy ones, or in some cases, there's even been abuse or extreme
Mm.
dysfunction growing up, and now you're faced with having to do something that maybe you don't feel like is right for you. So caregiving is very complicated, and I just want to acknowledge that and validate that for people. Okay, so as we close up, I just want to say that the more organized you can be, the more information you can have, not just about what your loved one has in terms of medications, providers, but also their needs, their current needs, enlisting other people to help, and connecting with local people for support. All of those things can make things a little easier. It's always going to have some level of difficulty, but the more you can make things easier and get yourself some support built in, it'll definitely help with stress. But if you haven't already, but you like what you hear, please subscribe on your favorite listening platform or leave us a rating and review. If you have a question or comment, or if there's something you'd like us to cover, please email us at dhbhs.media@hitchcock.org. And thank you for listening.